Hi, my name is Brittny Jones, and I will be doing a nasal gastric insertion. I'm looking at my physician's order before I go into the patient's room, looking for any allergies. And now I will go into my patient's room. Hello, how are you? My name is Brittny. I'm your nurse today. I'm going to be doing a NG tube nasal gastric insertion. Could you tell me your name and date of birth? Do you have any allergies? Okay. First thing I'll be doing is checking for patency in your nerves and in your oral cavity, and they look patent to me. Um, the next thing I will do is measure this tubing here from your nose to the ear to the xiphoid process. Okay, and then I'll put a piece of tape here so it'll help me know where to stop once I insert it. Okay. Now we'll perform hygiene and put on my gloves. And I will lubricate the end of my tubing, and I will insert it going downward. And I will ask my patient to lean his head back and make sure that my patient is in high Fowler's position. And also I can put a towel here just for safety precautions. My patient head is back, and as the patient head goes back, I'm just checking for coiling. There's no coiling going on here. And then I'm going to ask my patient to take a sip of water so I can advance the tubing. And if my patient starts to gag or cough, then I will withdraw it and then finish reinserting the tubing. Okay. I stopped at my tape mark. Now I will anchor it to the face. Excuse me. And now I will check for placement, and I can also send my patient to get an x-ray or to ask my patient to speak. That will also help me verify placement. Right now I will be drawing up 30 mLs of gastric content. Then as I insert it, and I'm looking at my gastric content as well, I'm looking at the characteristics of it and the color, and it's reddish, brownish, so there's some bleeding going on. And so now I'll be inserting the gastric contents back into the and listening with my stethoscope in the epigastric area. I heard a swishing sound. Now I'm going to anchor it to the nose. Okay, and take the safety pin and pin it to the patient's gown. Okay, then after that I will be connecting the tubing to the suction. And my documentation would include the date, the time, the size, the length, the type of tubing, and the client tolerated the procedure well. The content, the color and the consistency, it was loose and it was reddish brown, and also the patient tolerated very well I also told the patient to let me know if they're experiencing any pain in the abdomen or any discomfort overall, to let me know if if he has any discomfort. And also, if the pH was tested, I will also document that. And also, I would document that I took out 30 ml and I put in 30 ml. And that's what I would document for NG tubing. Now I will be doing the irrigation. I'm coming into my patient's room, and I will be putting on my gloves. Taking the tubing from the suction, and I will be checking for placement. Okay, and I'm going to draw up 30 ml of gastric content. And as I re-inject the content, I will be listening with my stethoscope for any swishing sounds. Swishing sounds heard. Okay. Now I'm going to be drawing up 30 ml of normal saline. 30 ml. Now I will be inserting 30 ml and withdraw 30 ml. Then once I'm finished, I will discard my syringe and I will connect the patient back up to the suction machine. And I will document the color, which was reddish brown. The patient tolerated well. I made sure I told the patient to let me know if they have any other discomfort. I instilled 30 ml and I got 30 ml out. The patient, the type, it was gastric and it was loose, reddish, and pretty much the volume that I got out was 30 ml. So that's pretty much it. Thank you for looking. Yay!